So I think with medicine, because it's so competitive, quite a few people won't be made an offer the first time that they apply. And I think you shouldn't be too disheartened. You could reapply the following year. It kind of depends whether you make the grades at A level. So if you aren't made any offers and you get your grades at A level, it's always worth reapplying the following year. You might want to get some feedback from the places that you didn't get offers from the first time to see why you weren't made an offer, and then to decide whether there's anything you can do about that. So sometimes it might be that you could apply to different medical schools who use slightly different selection criteria, or sometimes it might be you have to reflect back on skills that you weren't able to demonstrate at interview and see whether there's any way to develop those before you apply the second time to increase your chances of getting an offer the second time round.
That happens sometimes, that applicants, they have an offer and they can't really meet the grades. Hopefully you have not just one offer, and best is to go back to those universities and ask, is it possible still with those grades you have still to get a place? Sometimes it happens in the last minute, people drop out for various reasons and places become available, so sometimes universities would drop a grade if the place becomes available. So I think almost until the last moment you should still keep an eye and be in conversation with the universities. If that is not possible, then again goes back to the first question, you're reapplying, and meanwhile you are using and accruing experience you can talk about in the interview and increase your chances for next time round.
There are a couple of different things that students might be able to do. First of all, you might want to consider whether you can resit your A-levels or whatever qualifications that you're taking. Check with the medical schools first though. Not all medical schools will accept reset candidates, but some will. And it might also depend on what the grades you achieved with. They might have a lower threshold that you had to achieve in your first setting. You could look at gateway or foundation courses. So they're courses that already have lower entry requirements to get in. So have a look to see if you qualify for any of those, whether you could reapply the following year with the grades that you've got and see if you could achieve a place on that. You could look at graduate entry courses. There's two different types of graduates going into medicine. So students who have already done a degree programme already, and there are graduate entry courses for those students in medicine, which are 4 years. They often have lower entry requirements to get in. You can also do a second undergraduate degree, which is another 5-year degree programme. And again, that often has lower entry requirements to get in. But it's really important to note that currently you're not funded for a second undergraduate degree programme. So students who pursue that option do have to self-fund it. So look into that really carefully before you start.
Different medical schools probably have different policies for this. At my own medical school, we will allow people to apply twice. If they apply once and are unsuccessful, then we'll allow them to apply a second time.
You do get students who apply more than once, sometimes twice or 3 times. Don't be disheartened if you don't get in. Again, it might just be that you're not ready for medicine at that specific point. There may be a point where you've applied a certain number of times and actually this is the point where it's not for you anymore. I would say usually about 2 or 3 times would be your max in round of applications.